you tell us, I guess, who you are and a bit about your background?
Sure. So I'm Tasha Saecker. I'm the Assistant Director at the Appleton Public Library. That's my current role. I've been there here, I guess I should say 9 years now. Before that, I was a director at the Menasha Public Library, which is directly south of Appleton, for about 4 years. And before that, I was the director at a very small library in Green Lake, Wisconsin, for about 11 years. And before that, I was the head of children's and young adult services down in Cape Girardeau, Missouri. But I'm a Wisconsinite. So lived in Missouri, southern Missouri, for a very short period of time, about 4 years, and then came back to Wisconsin.
Great, great. We wanted to hear your take on what we're calling inclusive leadership and how to lead and manage for an inclusive staff and an inclusive community. And the one thing we have done is we looked at your program offerings at your library compared to, and not to put them on the spot, I just chose a random by city. I picked Fond du Lac.
Okay.
And you know, what we noticed is, oh, you had Hmong classes and you had bilingual story time and those kind of things. And you know, those things don't happen by accident. So talk about how you built up to that, if you don't mind.
Sure. So we had a marvelous young woman come and talk to us. She was in, I think, in the Madison program, getting her MLIS. And she was a native of Appleton, raised there, grew up she came to the United States at age 4. She had been raised in a Hmong refugee camp and then came to the United States at age 4 to Appleton. She came and talked to us about what she'd like to do as an internship for the summer, and that she'd like to focus on reaching out in some way to the Hmong population. The Hmong population does not have a very strong written, I lost you guys.
Oh, you did?
Yeah, but if I'm still here, I can keep talking.
Okay, maybe
there you are.
A glitch. Okay, yes. Maybe even the computer was sleeping. I'll try to be more aware.
Okay. So Yi came and talked to us about an internship at the library. We do that quite often with students from both your program and the Madison program. And her idea was reaching out to her community. Like I was saying, they don't have a really strong written communication. It was invented in the 50s. It's an entirely oral tradition. And so she was trying to figure out how to get people in the Hmong population to use the library more willingly and to understand what a library had to offer for them. She created a program. We allowed her to just kind of invent it. We then did a grant funding around it that turned into Appleton Ready to Read and a Hmong outreach specialist position for Yi. She's no longer in that position. She now has moved and transitioned into a librarian position in our community partnerships section. So she's still doing work with the Hmong community in Appleton and still doing amazing programming, and she started that for us. From that point, when she did this for our children's department, we then branched it with additional grant funding to include a Hispanic outreach specialist that we now have as well. And so we do programs that are specifically designed in our children's section to be non-story times. So the kids don't have to sit around and listen. They're much more active. There are stations that they go around to, and then storytelling is kind of built into it rather than sitting and looking at books. We're shifting away from that now because we want to form a more integrated process where we'll have people who speak Spanish, Hmong, and English all coming to the same programs now. So we did the kind of separate thing. We got families very interested in being in the library. Now we want them to feel that they're part of a larger community. So that's where we're moving to now.
That's really interesting. And I noticed, and this is on something we'll talk about later tonight in this class. One thing we were going to talk about was there's a library in Oak Park, Illinois that's really doing a lot with homeless services, but they're including, and I'm sorry, I can't remember the term, but it's like people who have actually experienced homelessness they're being used to help create the programming. And it sounds like, you know, of course it was really important for somebody who was Hmong and understood the community to try to make that first step. And so that makes it even more important to have this kind of inclusive staff.
Definitely.
So reach the patrons. So that's pretty interesting. Any other comments from the class? Or I think she can hear you if you just shout out. So there was one of the other questions about leadership was what do you think are some blind spots in public library policies and processes that could like unwillingly lead to bias or hurt a leader's attempts at inclusion? And are there some recommendations you have to get over those?
So I think right now is a really interesting time to talk about fines as a major blind spot, because we're kind of in the middle of the transition, right? Where we didn't see it as a blind spot for the majority of my career. And I probably never said how long I've been in libraries. So I've been in libraries and library leadership for over 25 years, and soon that's going to be 30, but I'm not quite ready to say that yet. Give me a couple years. Fines were just a given, especially in libraries the size of Appleton, the size of Milwaukee, Chicago, any of these major cities that are now looking at that. And I think it's really an interesting time to be a student, figuring out what that means when we're starting to look at barriers for things that we just take for granted. I don't even know that it would be considered a sacred cow, particularly. It's just something that we have always done, right? And we have to start looking at all of those things through the lens of blind spots, bias, where we just are making assumptions. This is just the way it's always been. It's just the way it's always going to be. Appleton is currently looking at fines and doing away with fines entirely. We'll probably do that sometime in 2020. We're in the process of bringing our board along right now in a three-part series of this is what fines are and what our fines look like. Here's what librarians are discussing, and then a proposal in the third piece to say, here's what we would really like to do to remove barriers in our community. So I think fines is probably one of the most interesting things right now. But we have all kinds of blind spots in libraries, and that just happens to be one that's in flux across the nation. We have issues with behavior policies, especially if you're serving a very diverse population. You can have problems where you are interpreting in a behavior policy or the way that you're approaching people who may be breaking the rules, and their attitude comes off differently depending on their background. One of them that I would mention, since we've been talking about the Hmong population, is eye contact. And so you can have somebody who you may consider being disrespectful because they won't make eye contact with you when you're giving them the librarian finger. And it's a cultural piece. And so we have to be really careful that we're not making assumptions with our behavior policies and the way that we're engaging with our customers in figuring out how to be more culturally literate as librarians going forward. So I think we got just so many blind spots that we don't even realize, and we just have to start having those conversations.
Yeah, that's great. And do you do any particular, this is kind of related to that blind spot topic, is there any particular like empathy training or diversity training or things like that, and that you've been involved in or that you think is particularly effective or ineffective?
So I actually made a list because I'm never going to remember all the training that we do at Appleton. So here are some things that we've done in the last couple of years. For not just empathy, but for diversity training as well. So we did specific diversity and inclusion training where we had somebody from Oshkosh called Fit Oshkosh come in and talk to us about our biases, still, even though we've been working on diverse hiring for a very long time, we're still a majority, as most libraries are, white women who are middle class, right? That's what librarians tend to be. So having somebody come in and talk to us very openly and expect us to talk openly about diversity and inclusion was, I think, very refreshing and really important for us to start talking through. So that's one. We had a program on autism. We bring in organizations that work with people around our community and specialize in different things, and we do this on a monthly basis where we bring groups in. So we recently had autism, LGBT, homelessness, poverty, trauma-informed care is really big in our community now, and talking about how trauma and understanding trauma can inform the way that we are giving service for our community. What we consider a simple conversation can slide out of control because of previous trauma in somebody's life, and understanding it with the empathy from that point of view. And crisis intervention, we've had our police department. And then the last thing I wanted to mention is that we're doing an 18-month series with Rogers In Health, and they are doing compassion resilience with us. We're the first public library to do it in the state, and they're leaders in the nation in this. And compassion resilience is how you take care of yourself and set healthy boundaries and do self-care to make sure that you can come to every interaction with compassion, not burned out and struggling. And so we're doing that for our staff. It's every other month that we have what are called compassion resilience circles, where we sit and talk through what helps us as a staff create a shared vocabulary to talk about this. We're still in the beginning phases of it. We're about 4 months into, like I said, an 18-month process, but it's been working so far. They use it quite a bit in healthcare and schools, and are now beginning to realize that community organizations like libraries, United Way, service agencies, things like that, need this just as badly as schools and healthcare professionals. And I see a hand.
Yeah. Tasha, are you like a pilot program for this? Will they roll it out after they take some metrics and see if it was successful? Or
right, so we're a pilot for them. We are getting a really wonderful low rate to kind of be the guinea pigs and figure out what. So we aren't healthcare, which they have a toolkit for, and we are not a school, which they have a toolkit for, and we're helping them invent the toolkit that will work for an organization like ours. So hopefully after the 18 months, they will figure out that. So we took a survey early where people didn't really even know what compassion resilience was, about how they were feeling, and then we'll take another survey towards the end of the process to see if we've moved understanding of compassion resilience, had people start to use some of the tools. So they'll be doing studies along with it, and they have a data person who will be coming in and doing measurements and joining in our circles and watching how they're working as well.
What's the organization called?
It's called Rogers In
Tulsa or Milwaukee?
Yes.
Related. Yeah.
And there was another hand?
That was my question.
Okay. I kind of have a logistics question.
Yes.
And we have someone in this class we've talked to who works at our writing center here at UWM, and the manager does a really good job, meeting with people one-on-one to debrief about issues, and they have staff training to make sure they're all on the same page with policy and things like that. What's your magic potion for getting people on, first of all, kind of on board with your training, and then also having the time, because I don't know if that happens before or after, or someone's on desk and then somebody's missing. How to kind of make training work. I love it that you have this. I think you're doing a really great thing by having expectations set. So every month we have a new, like, okay, how to help students with patrons with autism or whatever. So I think having it defined as part of the job will be that you do continuous training and continuous learning and it's part of your culture. I think that's good, but down to the nitty gritty, how do you make it work?
Well, we have a staff key, so it's not me saying here's what we should learn about this month, and it's not the director saying it. It is staff coming up with the idea. Very small but powerful committee that brings this together every month. So I think that that's key, that it's not driven from the top down, it's driven from the staff and what they want to learn about. We also, in addition to our monthly ones, do a full day or a half day closure once a year where we bring someone in that we pay actual money to talk. So all of these other ones are free usually where they come in, but like the Fit Oshkosh person I was talking about, we paid a fee to come in and do a full day with staff. We make it a priority. The monthly ones we do from 8 to 9 in the morning while we're closed, and then make sure that people can get on desk really quickly at 9. And then we have the closure, and then the compassion resilience ones we're doing during open hours. So that is, people are expected to be part of them. They have a choice of 5 different ones that they can choose from during the month. We try to space them out through different times of day. That works and doesn't work because people tend to be more available at certain times of day. So we've been getting the majority of staff attending those circles though still.
We're smiling about your kitty cat in the background.
Oh no. Howl. I'm hoping he doesn't start talking. Yeah, he's my talker. He's going into his bed now.
That's awesome. That's awesome. Another question from the students was, so xenophobia seems to be at an all-time high. How do you approach employees that may be set in their thoughts and ways of acting? Maybe you've seen them interact with other staff or patrons in an ignorant way or acting out of fear.
Sure.
And then the same thing with patrons. If you see patrons acting that way, I mean, that's a tough position.
Well, as assistant director, so my job really is, the director is the external face of the library. She does all of that political piece that I hated when I was a director. And I get to do all of the staff stuff and all of the internal running of the library, which is actually my jam. So when staff are having issues with xenophobia, about it, and we have a conversation about, here is the expectation to work in our organization, and you have to simply meet that expectation. My example for this one is we have a fairly new staff member, our first staff member, who uses they, them, their, and our staff is doing really well. The new staff member feels very welcomed. They've expressed that to us, and that they've never felt this accepted in another organization. But I have one supervisor who knew this person before they transitioned and will not, right now, and we're having blunt conversations about this, continues to refer to them with their dead name, with their previous pronoun. And so this person, the supervisor, also happens to be a member of the LGBT community. So it's not about what you necessarily think it's about, right? So you can't make these assumptions going in. You have to have curious conversations, be kind of open to things, but also be really willing to say, this is the expectation that we have, is that you're going to respect this person's identity and refer to them the way that they are asking you to refer to them. So that's one of my current puzzles that I'm figuring out with staff, but I think you just have to be really clear about things. Brene Brown, in her Dare to Lead book, said clarity is kindness, and I just kind of hold on to that all the time. If I can be really clear about what my expectations are then I'm being kind about it. So I'm not setting you up for failure. I'm saying, this is it. This is what I need from you. Can you do that or not?
Wow, that's great. I mean, I'm sorry about that situation. That just seems crazy to me.
Right. Yeah, we'll get through it. There's something behind it that I'm not understanding, and we'll figure it out.
Yeah, I liked your discussion of the approaching it with curiosity instead of assumptions. I think that helps in so many situations.
For sure.
So there was one more topic I wanted to bring up, and I'm not sure if I mentioned it via email.
Okay.
So feel free to say like, no, I'm not prepared to talk on that. That's fine. But when you bring people on board, let's say someone who's Hmong from the community, or someone who maybe doesn't have their MLIS, but they're helping to run a bilingual story time. How do you deal with what has kind of been coined imposter syndrome, where people on your staff might not think like, oh, I don't deserve to be here, or they question a lot of what they do, because I feel like our goal is to really hire a diverse staff, but what a diverse staff might have, that kind of a staff of all people of privilege might not, is this kind of, are you guys familiar with imposter syndrome? Yes. We didn't read an article specifically on it because I just felt like I could have put a million things in this week, but it's this kind of pervasive self-doubt that could come when someone, let's say, you know, oh, I'm first generation university student, and then when they come into the classroom, they might have all these doubts and not participate as much as somebody whose parents were talking about, I can't wait till you go to college, since, you know, the day they were born. So, you know, it's kind of what people are coming to your organization with. Do you do anything to kind of proactively deal with imposter syndrome, or have you not really seen it play out? I guess I'm interested in hearing your experiences.
Oh, that's a really great question. I haven't had a chance to think it through.
Sorry.
No, it's okay. I've seen it definitely play out with staff. We tend to, so we're a mid-sized library. We're not a Milwaukee. So we hire people who are fairly new to being a librarian as managers, as well as librarians, of course. So I'm thinking of one person in particular who has like the least, empirically, as I look at her as a supervisor, she has absolutely no reason to have imposter syndrome. In fact, she's our only staff member with a PhD. She just finished it recently. No reason. And one of the most intelligent women that I've ever worked with, and empathetic and gifted and all of these things. But you can watch her have doubts. And so I think my job is just to be there if it happens, not expecting it to necessarily happen. She happens to be a person of color. And I don't know that that plays into it for her or not. But she certainly struggles with whether she deserves to be a supervisor at this point in her career, and whether she has the abilities to lead a very veteran staff. She tends to be younger than most of her staff at this point. I think that a lot of those elements play into it too, where you can start to doubt yourself if you're the one constantly suggesting that we need to change, we need to update, and your staff is pushing back on that regularly. I lost you for a second, but you're back. So, so I don't know that I have any strategies except to watch for it and be willing to talk. I'm one of those people who talks a lot with folks and chats. We have little chats about what's going on with them, and this person that I'm talking about tends to be really open to that and come in and just kind of, let's puzzle this through together. And that's one of the reasons that I know that she's struggling with some of these pieces for her. So I think as the leader, it's my job to be there and make those conversations okay to have, and not come back with anything negative about her doubts or saying that she's not confident enough, or doing something, say on her annual review, which we're doing right now, of course, for our entire staff, that she needs to develop in those areas, because she's harder on herself than I would ever be. So it's my job to be there to support her.
Great, great. One thing I noticed